Diagnostic medical sonographer. Diagnostic medical sonographer job responsibilities. A diagnostic medical sonographer collects patients' data and makes it accessible for the doctor to further evaluate the results. Sonographers use a transducer machine which produces sound waves in order to have a better view of a patient's internal body. Sonographers are able to view the internal body movements of a patient to detect if something looks normal or if there should be levels of concern. Sonographers are in charge of patient records and maintenance of the equipment to make sure that the machines are working properly. Work settings. Sonographers typically work in hospitals, clinics, and health centers that specialize in assisting patients. Some sonographers work in physician offices and medical diagnostic laboratories. Sonographers that work in this type of work environment focus on a specific department such as gynecology, cardiology, and etc. Some sonographers travel to distant areas where people do not have the resources available for them to get ultrasound exams. Educational requirements. Diagnostic medical sonographers have the option of obtaining a 2-year associate degree or a 4-year bachelor degree program. There are few states that require diagnostic medical sonographers to be licensed, but the majority of the states do not require them. 1-year certificate programs can be obtained from many colleges and hospitals that offer them. Diagnostic medical sonographers can earn a certificate by graduating from an accredited program and passing the sonography exam. Core skills to be a diagnostic medical sonographer: maintaining a good relationship with patients, having a positive attitude, critical thinking skills, being able to work independently, being effective and being able to deal with pressure situations, being able to recall information and data from patients, having intrapersonal skills to work closely with patients, must know how to work the machines and computerized devices. Employment outlook. Diagnostic medical sonographer employment opportunities are expected to grow 26% from 2014 to 2024. As the imaging technology expands, medical facilities such as hospitals and clinics will continue to use ultrasound machines and replace other procedures that are more expensive. Diagnostic sonographers will be around in the future to help with treatment options and diagnosis. Diagnostic sonographers' employment opportunities are expected to grow more in physician offices and medical and diagnostic laboratories due to the shift that patients do not have to be admitted to a hospital and the costs are much lower. Career path in diagnostic medical sonographer. I want to focus on obstetric and gynecologic sonographer because specializes in the female reproductive system. Many pregnant women receive sonographs to help track the baby's growth, development, and overall health. Obstetrical sonographers work together with the physicians to detect congenital birth defects. Why I selected diagnostic medical sonographer. I selected a career in diagnostic medical sonography because I want to help many pregnant women to make sure that their pregnancies go as smoothly as possible, make sure that there is no complications with the developing fetus, assisting pregnant women to ensure that the baby is growing at a moderate pace. A diagnostic medical sonographer can be able to detect the normal and abnormal growth and be able to detect birth defects. Thank you. This is the end on my presentation.